Hello, this is Angelia, and you are listening to or watching the podcast Why You Do What You Do. We're having some mic issues here, so bear with me. Turn up your volume, if it's not happening for you. I think this thing has a short or something. But anyway, um, we have been talking about, you know, abnormal behavior. And we're going to kind of start into the management, and that is the word using management of abnormal behavior. So yeah, let me see if I can get this to work a little better. It's not going to work a little better. Okay, well, like I said, turn your volume up. Yeah. Uh, so let's take up on that. We have attempted to relate all the difficulties associated with defining, describing, and explaining abnormal behavior because, again, it depends on what you think is normal as to what is abnormal to you. Clearly, it is a very complex process integrating concepts that are formed at the very lowest level of social organization, the simple individual, with these formulated by the intricate meshings of society and with those of many different societies. Because here on planet Earth, we have many cultures and we have many different societies. So, what one thinks is okay, the other might not think is okay. So, it is made even more complicated by a necessary final question. How do we manage the problem? That is the age-old question, isn't it? What do you do about folks that are not quite right in the head? What do we and what should we do with people who exhibit abnormal behavior? And everybody has an opinion on that, I'm sure. The term management may seem a little inappropriate in this particular context. It sounds too businesslike, a little cold and uncaring. After all, aren't we talking about mental patients? Shouldn't we be discussing treatment or cure or at least interventions? And you'll hear all of these words, when you're in the mental health field, and different people use for different things. But I think intervention, treatment, management are probably the right words because there some things there is no cure for. So we have chosen the term management instead of treatment for two reasons. First, treatment implies an ability to overcome the problem or to cure the patient. And that's not necessarily true because you can treat, you know, um, things that you can't, you know, eradicate. So I'm going to disagree with their terminology there. At best, we treat symptoms. We certainly do not cure. And, again, that's usually the case. No one knows why or for how long these treatments work. Second, treatment implies a more caring attitude than has generally been shown. So, in historical, I mean, like if you look at the story of Dracula, poor old, Renfield is in the mental institution and they're not being great to people in there. So, in the past, people have not been treated so well in the asylums. Um, It would be false to say that we have never been caring about those troubled with mental disorders, because there have been doctors who have, and that's why they started, the field of psychology. So, history proves that management, that is, coping with the problem, trying to get around it in order to get on with living, is really the most appropriate term. Because, I mean, that's what you're doing. You're coping with the problem and managing the symptoms. Perhaps our attitudes result from the fortunate fact that the incidence and prevalence of most mental disorders are low compared with, say, the number of diseases, which can, excuse me, I'm adjusting my desk here a little bit, Also disrupt lives, even though there is no way of telling how many divorces are the result of mental problems. Yeah, I know some that have been the result of mental problems that people didn't want to treat or manage. Um, and of course, the more the public is aware of any issue as a widespread problem, the more willing it is to cooperate in trying to solve it. As we said, humanity has not been unresponsive. Many times in the past, there have been a real desire to eradicate the problem of psychopathology once and for all. And that's what the study of psychology is all about. We want to learn how to treat and help people that have mental illnesses. Many attempts were made to improve the situation, and many succeeded. At the most general level, the societal response to abnormal behavior is determined by the culture, by its nature, and beliefs about what causes the phenomenon. These factors, in turn, affect how the people close to an afflicted person, family, neighbors, colleagues, friends, will respond. In addition, societal beliefs also influence the person's own self image because, we internalize things, and if people are saying the thing about us, we might internalize that. I've learned to not do that now at this point in my life, but when you're younger, especially, you'll do that. The treatments used for abnormal behavior would depend in large part on the explanation that is currently in vogue. And that's unfortunate. Like I said, we learn something new every day. Like I said, in the Middle Ages, it's all because they were evil. And then in Freud's deal, it was all about sex. We learn more. Just as in medicine, you learn more every day that can help people. If possession by devils is the prevailing explanation, then whatever is required to exorcise these devils is clearly the appropriate treatment. If unconscious conflicts are to blame, then bringing them into consciousness so they can be faced and resolved is in order. If the problem is simply a result of poor social skills, then training in social competence will set matters aright. And there are counselors who do that. I did that. I know a counselor who does that. Sometimes people just grow up in a situation where they're not taught manners, they're not taught social skills, and that leaves them, pretty unable to keep and have relationships. Um, the preferred treatment tends to change only when the explanation changes. The different kinds of abnormal behavior have different etiologies and require different treatments. The range of past and present societal responses is enormous, from relative indifference, ignoring anything but the most destructive or bizarre behavior, to ruthless action, executing anyone who is too different. And there were countries back in the Middle Ages, and even up to the French Revolution, really, that thought, okay, if you're not with us, you're against us, and off with your head, kind of a deal. In small traditional societies that strongly value the nuclear family, such as father, mother, and children, dear old Aunt Agatha, with her strange ideas of religious persecution and damnation, will probably be seen as a problem for the family, not for society to manage. Excuse me. Aunt Agatha's family would never consider sending her away. But in urban areas and highly technological societies, the size and importance of the traditional family have eroded. We see that all around us every day. There is little room, too often literally, and even less patience for maintaining mentally disturbed family members at home. Because, like I say, we are full. Most people I know are full. Very few people have extra bedrooms anymore to put somebody up in. The village idiot, once the source of humor and pity, is now safely ensconced in a state school or hospital. So, that's just become the way we do it now. Research conducted by Kitano clearly illustrates this point. In Hawaii, Japanese Americans are divided into three major groups. Issei, first generation immigrants from Japan. Nisei, the second generation, born in Hawaii of first generation parents. And Sansei, Japanese Americans born of Hawaii in Hawaiian born parents. Of these groups, the Sansei are much more acculturated to a typically American way of life. The Issei, on the other hand, still hold to the more traditional Japanese culture, and that's the case with anyone. Usually, a first generation that comes as an immigrant is holds to their traditional ways, and the second generation goes both ways, and then the third one usually acclimates to the society at large. American way, yes, the Issei still hold to the traditional Japanese culture. Kitano studied hospitalization patterns for mental disorders, for all three groups. As expected, the Issei had a much lower rate than the Nisei and Sansei. In fact, it was even lower than that of other ethnic groups living in Hawaii. It was very close to the hospitalization rate of mainland Japan, where the cultural response is still take care of your own. The Issei who were hospitalized were severely disturbed, which means they stayed there longer and were less likely to be discharged. In addition, the typical hospitalization of Issei was an elderly, single male with few or no family ties. So they just had nobody to help them and take care of them. Among the Sansei, the rate was virtually the same as that for any other ethnic group in Hawaii, and much higher than the Issei and even the Nisei. Clearly, this group had adopted a more modern American attitude toward the way of responding to abnormal behavior. A review of how behavioral deviance has been managed over recorded history is interesting and provides support for our major contention that the societal response to abnormal behavior reflects the prevailing theories of cause. Because, like I said, it's changed over the years, just like medicine has changed over the years. In the medieval days, you were sick, put some leeches on that. The primary view of abnormal behavior during ancient times was that the person was possessed by evil spirits. It followed, therefore, that bringing the person back to normal required getting rid of these spirits. The only problem was to figure out how this could best be accomplished. And the Catholic Church made a business out of this. Records of the time show that there was a good bit of conflict on this point because people disagreed. You do this. No, you do this. No, you do that. So even then, there was disagreement amongst the people on how this was best to be approached. And that is where I'm going to leave you for today. I hope this helped you figure out maybe a little bit more about why you do what you do. Thanks for watching or listening. Please like and share this educational program. And that's what this is, an educational program. It's not designed to diagnose or treat any mental illness. And if anything I said triggered you or is a problem in your life, then by all means, go talk to your mental health professional. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. The links to that are in my posts. That's all for now. Until next time.